In the fifth and final section now, let's discuss about some skin and connective tissue diseases that can complicate pregnancy. In this section, we will talk about systemic lupus erythematosus, SLE, scleroderma, and some other skin diseases. SLE or systemic lupus erythematosus is a multi-system disorder characterized by periods of relapse and remission. So it's a multi-system disease. It affects different systems of the body, but it has periods of remission and relapses. So patients who have SLE, they have periods when they are completely normal. They seems like they have nothing wrong, but when they have periods of relapses or when attacks occur, their condition is really very miserable. They have pains, they have body aches, they have different other involvements. So it's a condition in which there is involvement of multi-systems, and then there is period of exacerbation and remissions. Implications of pregnancy on SLE. Relapses occur more frequently and increase in flares in postnatal period. Risk of deterioration in renal function. So the renal functions can be affected. The relapsing period is longer during pregnancy, but after the delivery, in flare-ups, there is increase in the flare-up of the disease. Then implication of disease on pregnancy, increased risk of miscarriage, stillbirth, preeclampsia, in utero growth restriction, preterm birth. Infants are at risk of neonatal lupus and congenital heart block. So it has effect on pregnancy. The infants are at risk of neonatal lupus erythematosus, and it can also cause heart block in the infant. Now, the differentiation of SLE flare from preeclampsia. Preeclampsia and SLE hypertension, usually there is proteinuria in both. Then we have thrombocytopenia or decreased platelet level, and renal impairment is present in both the preeclampsia and SLE hypertension. In SLE only, usually there is rising anti-DNA titer, fall in complement level, no increase in serum uric acid, and no abnormal liver function present. So that's the difference between the SLE only and SLE and preeclampsia hypertension. Now, the other condition is scleroderma. Scleroderma is a condition in which there is increased movement of fetal cell into mother bloodstream, and that's the picture of the scleroderma. Complications of scleroderma is miscarriage and abortion, pregnancy-induced hypertension, preeclampsia, IUG or intrauterine growth restriction, hemolysis, and HELLP syndrome. So all these are the complications of scleroderma, which is the condition in which there is increased movement of fetal cell into mother bloodstream. Physiological changes in skin during pregnancy. Physiological changes are the changes that are normally occur during pregnancy as a result of changes in the thinness of the skin, as a result of change in the vascularity of the skin. Different changes can occur. These are increased pigmentation, and this increased pigmentation occur on face, areola, axilla, and abdominal midline. Spider nevi, which affect face, arm, upper torso, broad pink linear striae or striae gravidarum. These striae gravidarum occur on the abdomen as a result of itching caused by the mother. Then pre-existing skin disease, we have redness, these are the blisters, then flaking of the skin, all these are present. So eczema or acne, atopic eczema, hand and nipple eczema, psoriasis. So all these are the pre-existing skin condition that can be present in women before the pregnancy. Retinoids contraindicated for treatment during pregnancy. Next, specific dermatoses of pregnancy. These are like pemphigoid gestationis. These are the changes or dermatosical or the conditions that affects the skin only during the pregnancy. We have pemphigoid gestationis. Then we have polymorphic eruption of pregnancy and prurigo of pregnancy. So all these are the different skin conditions that can be present only during the pregnancy. Pruritic folliculitis of pregnancy. So that was all about some skin and connective tissue disorders of the pregnancy. So that was all about the different medical conditions that can complicate the pregnancy. We talked about them in detail, and thank you for watching sqadia.com.